having an informational board briefing. In accordance with the declaration of emergency and extended by the Board of Commissioners on September 24th, it is being held virtually. I want to thank everyone in advance for bearing with us through any technical difficulties that may arise. Please remember to mute your mic when you are not speaking. And when you're presenting, make sure that your mic is unmuted and your camera is on. I ask presenters to please remember that the public may be listening via phone, so state your name before you respond to questions. Today's informational briefing is on housing services. Mark Jolin, good morning, and will you please kick us off?
Good morning, Chair. Good morning, Commissioners. For the record, my name is Mark Jolin. I use he, him, his pronouns, and I'm the Director of the Joint Office of Homeless Services for Multnomah County and the City of Portland. I appreciate the opportunity to be here this morning. We wanted to spend a little bit of time today briefing you on the Metro Supportive Housing Services measure and the progress that we're making towards the development of a local implementation plan. With me this morning are Nui Bazair, who is the management analyst who is leading this effort for our office. I'll introduce her shortly. She'll be presenting a significant portion of this, and also Joshua Bates, who is our equity manager in the joint office and has been leading a lot of the community engagement work. So he'll have an opportunity to share some of the specifics of that. But I will kick us off today. We'll try to move quickly through the slides and keep lots of time for questions, but please feel free to ask questions as we go through as well. So Tasia, are you advancing slides? Thank you. Great, thanks. So we'll go briefly through the history and the fundamentals of the measure. The fundamentals is an important piece because those are starting to take shape through the work that Metro has been doing with community partners. So we know more now about sort of some of the core elements of this measure than we did just a few months ago. We'll talk about the local implementation plan, kind of the overview of it, what's intended to be in it, and then leave, as I said, time for questions and answers. Next slide, please. So as a reminder for how we got here, this measure was really responding to a critical need in our community. As you all know, our community has continued to face an enormous deficit in affordable housing that is affordable to people who make 30% of area median income. Statewide, the National Low Income Housing Coalition estimates a shortage of about 96,000 units that are available and affordable to people who make 30% of area median income and below. There are about 28 units for every 100 households that are extremely low income. Metro estimates that in the metro region here, we're short about 32,000 units. In addition to that, we went into this measure having identified through our point in time count between 2015, 2017, and 19, a continued growth in chronic homelessness in particular. Overall, the homeless population, at least as HUD defines that, remained relatively flat over that period of time, but we saw double-digit growth in chronic homelessness. So people who are living with serious disabling conditions and are spending a year or more on streets or in our shelter programs. We actually saw about a 37% increase in chronic homelessness between 2017 and 2019. We saw about a 22% increase in folks who are unsheltered. And within the unsheltered population, about 78% of the individuals identified as having a disabling condition, about 28% identified as having co-occurring disorders, including a mental health condition and an addiction disorder. And then within that, as we've talked about many times with you, across the board, we see communities of color overrepresented in all aspects of the homeless population. But where we've actually seen the most pronounced increases in disparities are specifically within the chronic homeless population. So the rate of chronic homelessness actually grew faster between 2017 and 19 for African Americans, for people in the Latinx community, for Native Hawaiian and Pacific Islanders. And we see the highest rate of chronic homelessness among any demographic group in the Native community. So as you'll see, this measure is designed specifically to address all three of the elements of the need that are outlined here, as well as the broader need for housing stabilization services for people generally experiencing homelessness or at risk. Next slide, please. So then looking at the policy priorities that this measure is intended to advance both locally and regionally. First and foremost, as we've talked about, the urgent need for supportive housing to address the needs of the chronic homeless population. It's been something we've worked on locally for years. As you know, we adopted a goal to add 2,000 units of supportive housing over 10 years. And we made a lot of progress with the resources that we already had. But this Metro measure will get us to that goal and beyond that goal if we use the resources well. We had also, prior to this measure being adopted, passed 2 affordable housing construction bonds. As you know, both of those bonds can only go to pay for the bricks and sticks for the development of units. And we know that in order to create deeply affordable housing that's affordable to people who are 30% and below, and then to also have supportive housing, we actually need additional resources to bring to the project. We need operating supports, rent assistance that can be attached to those new units, and then we need the supportive services that can be attached to those new units. And the Metro Supportive Housing Services measure allows us to do both and realize the potential of those bonds. And then finally, perhaps the most innovative part of this measure is for the first time to really bring a regional perspective, not just to the housing development side, which the regional affordable housing, Metro Affordable Housing Bond did, but to the service delivery systems. And so what you'll see in the local implementation plans, and I think what will unfold over the next several years, is a real shift towards the regional planning and regional strategies to address what is absolutely a regional, statewide, and actually national crisis. Next slide, please. All right. Now I'm going to stop and I'm going to turn it over to Nui Bazair to walk through some of the fundamentals of the measure.
Thanks, Mark. I could advance to the next slide, please. Thank you, commissioners, for having me here this morning to talk about it. So as many of you know, back in May, voters passed what was called the Here Together measure. Now it's called the Metro Supportive Housing Services Program. It was really a measure that placed a tax on personal income and also business profits. That's really dedicated to support what Mark had just been talking about for this program, which is permanent housing and a continuum of services for the populations that we'll get to in a moment. This program really prioritizes addressing chronic homelessness, but also episodic homelessness. And we'll kind of look at how the funding allocations break down in a moment. We're trying to center equity as much as possible throughout the planning and also the program launch and design itself. Really trying to focus on ending racial disparities in rates of the different types of homelessness, so chronic or episodic homelessness. And really, we're working to, create that foundation that Mark had mentioned about working more collaboratively, both within Multnomah County, but across the Tri-County area. Move on to the next slide, please. So this is a timeline identified by Metro. The points really to take away here are there's a governance structure that's being created at the Tri-County level, but then also within Multnomah County. So at the Tri-County level, there's an oversight committee that's in the process of being assembled. Right now, we're in recruitment for that committee, which includes members across the Tri-County area. And that will happen, between now and November, I believe, is when that actually gets assembled. And then that group moving forward will be really tasked with monitoring the program overall, over the next several years, probably through the next 10 years. So really that body's purpose is to kind of make sure there's congruence between what had the language of the measure and then also how the program actually rolls out on the ground. Within our own county, each county is to create an advisory board that oversees the local implementation plan, which again, we'll get to in a moment. And And for us in Multnomah County, we're leveraging our existing infrastructure through a Home for Everyone. So that body will oversee the development of our plan and then also the launch of the program itself. On that note, program implementation is underway right now with the creation of a local implementation plan, which is happening, between September, and for us, that happens between September and end of October, because we will actually have our first kind of draft available by early November. So we're on a very short timeline for creating this plan. After the plan is created, of course, it gets approved, and we'll go through those kind of various levels in a moment. And then we work on rolling out what the program looks like on the ground through procurement, through program design, and also through coordination across the counties. And then finally, there's the revenue aspect of this, which money starts to flow as early or starts to be collected in the spring, and then starts to flow through procurement as early as July 1 of 2021. Next slide, please. So this is in an ideal state, the projected revenue for this program is about $250 million across the 3 counties year over year, right? So our first year, though, we are seeing significant impacts with COVID, so we're not quite sure what that number looks like yet. But moving forward in an ideal state, we can expect around $100 million for this county each year. That is after a 5% is kind of taken off the top of that $250 million, and that's really put aside for advancing regional priorities across the 3 counties. And just a note that revenue number for each of the counties is really a formula that was developed that really reflects projected collections by each county. That's kind of how that worked. I mentioned this briefly, that the first allocation of funds will start to be distributed in fiscal year 21-22, which is July 1 of 2021. That's when it starts, and it's on a 10-year renewal. And I mentioned again the oversight committee, but Metro really oversees the collection and also the expenditures of the funds. They're contracting with the city of Portland to actually collect the taxes. And then, of course, we allocate that revenue locally. Next slide, please. So now we're going to talk a little about who these funds are meant to serve and who they're meant to benefit. The focus populations or priority populations that are identified by Metro for this program are, first 75% of the funding. So the majority of the funding is to be allocated for folks who, roughly meet the definition of what we would consider to be chronically homeless. So they have very low incomes, less than 30% of area median income or median family income. They often have at least one disabling condition, and they're either experiencing long-term or frequent episodes of homelessness, or they're at risk of experiencing that long-term homelessness. So the majority of funding, again, is meant to serve those folks who are very high needs, who often are slipping through the cracks, who we really want to meet those goals of, not only ending disparities that we're seeing in our data, but, stopping that ever increasing percentage of folks who are chronically homeless in our system. Then there's about 25% of funds are to be allocated for folks who are more generally experiencing homelessness. You could think about it as episodic homelessness, but not frequent episodes necessarily. And then folks who have a substantial risk of homelessness. So they're on the verge, they're extremely housing unstable, most likely going to lose housing at any moment. And just to mention that, this program is really meant to end racial disparities, and the priority population across both of those kind of chronically homeless and then folks who are homeless or at risk is really communities of color, especially Black and Indigenous people of color, and then other historically marginalized communities. So you have kind of multiple layers of who we're prioritizing here. Next slide, please. So the services themselves kind of fall into two main categories, although it's called services. This program really provides rent assistance and then also more broadly support services. And we'll go through what all of those look like in a moment. And really that's because the purpose of this program is to stabilize folks in housing, make sure that the end result is permanent housing that folks can actually keep and afford. So, we're looking at providing access to housing for the target populations, making sure that folks are supported while they're finding housing, and once they reach housing, that they have enough wraparound supports to actually maintain that housing, particularly for Black and Indigenous people of color that fall within those two populations. Next slide, please. So I mentioned we get into the services. Although this is called services, again, it includes that rent assistance. So you could think about these service categories as sort of a continuum of when someone enters the homeless system, what are the supports that they need up through gaining housing? So, first in outreach and engagement, we're finding folks, we're engaging with them, building rapport. So this program can cover those types of activities, such as street outreach. We can even, cover engagement within shelters that's housing focused. So that would be shelter services that are housing focused. A number of kind of health, employment, and advocacy services that can support folks both as they're finding housing and then also after they've gained housing. And then finally, on the housing end, we've got both short and long-term rent assistance. This program can cover either of those. Permanent supportive housing services specifically. So why we call out those separately is really because those are meant to be more intensive, very long-term services to keep folks stabilized and housed. And then, of course, other kind of supports that would be available for folks that are actually in permanent housing. Move on to the next slide, please. So Metro has identified outcome metrics for this program. They are working to identify some more kind of process metrics and then also some coordination metrics. However, the outcome metrics have been largely identified. Data for those outcome metrics will be disaggregated, each and every one of the metrics, to make sure that we're evaluating any disparities in the outcomes that we're seeing with this program. The metrics are also consistent across the 3 counties. And they fall into the 3 categories that you see here. So again, housing stability being first, because this is meant to be a housing program. And then some other metrics that fall under that around equitable services and engagement and decision making. And we'll go through those in a little bit more detail right now. Next slide, please. So on housing stability, it's really helpful that an advisory committee actually worked with Metro to put these metrics together, and it's very helpful that they identified goals too. So really, what's the purpose of each of these metrics? Because it's possible that in the future, some of these might change a bit, but the overall purpose is stated here, which is very helpful. And so for housing stability, we're really working to make sure that housing equity is advanced, particularly for BIPOC, and then also that housing retention rates for BIPOC are equal or better. And then finally, we're trying, as a system, we're looking at making sure that we're reducing those rates of chronic homelessness across the system. So because we have kind of these programmatic and system-wide goals together, you'll see in the metrics that there's kind of a combination of what would be system-wide and programmatic metrics here. So in housing, we're looking at, for example, number of supportive housing units actually created, number of housing placements, but then we're also looking at more systemic things like, for the number of folks who actually need housing or who are experiencing housing instability, how many folks are actually getting housed? What are the rates of homelessness? How many folks are being prevented from entering homelessness? So those aren't necessarily programmatic, but those are more system-wide metrics. So again, all of these point to gaining housing, keeping housing, and making sure across the system that we're providing more housing compared to those who need it.
Nui, can you pause for a moment?
Yeah.
Commissioner Myron has a question.
Yes.
Thank you, Chair, and thank you, Nui. I just have a question about just the metrics, and in terms of housing stability, I appreciate that it's broken down into a number of different categories, but housing stability as the broadest category to me seems I'm not sure it gets at what I sort of view this measure as sort of promising. And, you know, as you mentioned, there's what we really need to be seeing is a decrease in the chronically homeless population that's experiencing, you know, one, probably more disabling conditions, et cetera. And I mean, I could see you can improve housing stability in general and not do anything with chronic homelessness. Like, I'm not sure how those fit together, but it seems, just given what the measure was designed to address, that should be elevated more than kind of, I mean, I don't even see how, I don't see it even in some of the breakdown categories.
Yeah, that's a good point. Mark, were you saying something?
So I can try to answer that, Commissioner. I think I would take them in sequence. So I think one measure will be how many people we actually move out of homelessness into housing, right? So that's addressing the population of chronically homeless people we have now. And then in order to understand whether we're being effective in the support services, then we're also measuring, do people stay in that housing, right? The concern is if that if we only measure the placements and not retention, we may be losing people back out to the street because we're not doing a good enough job on the retention end. So these two things sort of work in partnership together. It is not an either or. We're not actually assuming we're working with a lot of people who are currently in housing. There is that provision for folks at imminent risk, right, of chronic homelessness. So we might have somebody who's been chronically homeless in the past. They're in housing, they're facing losing that housing imminently first because they don't have the supports they need or they don't have the rent assistance they need. And we can intervene there, but only if we demonstrate that but for that intervention, they would wind up back out on the street and become part of the chronic homeless population again. But by and large, that retention piece is just to ensure that the placement work we're doing is actually effective and keeping people housed.
Thank you. That is really helpful, and I appreciate that framing.
Commissioner Jayapal, do you have a question?
I do not, Chair, not at this point. Thank you.
Thanks. How about Commissioner Vega-Peterson?
Not at this time, thanks.
Wonderful. And Commissioner Stegman?
Thank you, Chair. I did have a question. So in the housing stability, it talks about the proposed annual metrics, number of supportive housing units created. So Mark, you started out with your presentation that talked about that we are 32,000 units short in the metro area. So I'm just trying to kind of marry up, like what do you mean by supportive housing units created compared to we need 32,000 units? And what's the difference between those?
Thanks, Commissioner. This is, for the audience, this is Mark Jolin again. So the 32,000 is sort of the deficit of units that have rent levels that are affordable to people who make 30% of area median income and below. The supportive housing, you know, is a combination of both that deep affordability and the wraparound support services. So it serves a subset of that extremely low income population. And you know, we have the opportunity with this measure to essentially add, you know, well beyond the 2,000 units that we committed to creating. That is supportive housing. That is that combination of deeply affordable and to this extremely low income population and support services. I think to your question about creation, we mean that broadly. Like, this measure does not fund the construction of new units. What it does allow us to do is leverage new units that are being created, but that without a subsidy can't rent at the levels that we would need them to rent at, right? So we can attach long-term rent assistance to new units that are being developed. We can also attach rent assistance to individuals who can then go out into the marketplace and seek out a unit that they want to live in, much like you can with a housing choice voucher that's portable. So we have a range of ways in which we can add to the available permanent supportive housing inventory that may include leveraging new construction and existing units in the market through the creative use of the long-term rent assistance, and then attaching support services to individuals, regardless of whether they end up in a building that has lots of supportive housing units in it, or in a complex where they may have the only supported unit in that complex because that's where they've chosen to live, and we can bring the support services to them. So it's not, to be clear, not constructing lots of new units. It is partnering with the construction and with existing inventory. Does that get to your question?
Yeah, that's helpful. But I mean, but still, I mean, it's kind of like we're just moving, pieces of the puzzle. Great, because I mean, we do need to have more supportive services, but ultimately we are not increasing the number. Like, we need 32,000 units. We're still short 32,000 units, but am I correct in saying that we're still able to give higher, or we're able to subsidize more of the units, but it doesn't, I mean, and I know this is a greater topic, but I just am concerned, while this is important, but it just doesn't get us to where we need to ultimately go, or does it?
It does get us in the direction of where we need to go. So when we say, when the national, when Metro or others say we're short 32,000 units, they're not saying we don't have the physical units. What they're saying is we don't have the units renting at the levels necessary to be affordable to an extremely low income household. So when we take a market rate unit, for example, that is out in the community now, right, but it's not affordable to an extremely low income household, and we give that extremely low income household rent assistance, we make that unit affordable to them, right? So every time we do that, we add a unit of deeply affordable housing against that deficit that we've identified. So it by itself, this measure is certainly not going to eliminate the entire deficit that we have in our community, but it will increase by several thousand the number of units of housing that we have that is, that are affordable to people who are extremely low income, and have the additional benefit of serving those folks for whom the rent by itself isn't enough. There needs to be that added component of services. So we are not just moving things around. We are actually advancing our our goal of increasing the supply of deeply affordable housing in our community, and also our need for supportive housing.
That's awesome. I'm really pleased to hear that. Thank you for explaining that. It was a little bit confusing, but I appreciate the explanation. Thank you.
You can continue.
Thank you. So that's housing stability. By and large, this is a category that has the most amount of metrics that we'll see. Again, system-wide metrics and kind of program-based metrics. And just a reminder that these are the same across the 3 counties. Next slide, please. So the next category that's been identified for metrics is equitable service delivery. And again, the goals or kind of purpose is stated here. We're really focused on increasing capacity for culturally specific organizations, but then also for other organizations, really working to make sure that providers are building anti-racist and gender affirming systems, that include culturally responsive policies, standards, and then also that we're making sure we're providing technical assistance, not only for the capacity building, but for training around best practices and any kind of, types of gaps that we've identified and how to remedy those. So in terms of how that plays out in metrics, we're looking at the scale of investments. Again, this is more of a system-wide kind of investment and can be looked at on the program level as well. Make sure that the scale of the investments are made through culturally specific providers, and to the extent, what does that scale look like? How much of the total funding does it include, and kind of what does that get us as well for those culturally specific providers? What does it do for them? Does it meet their needs for capacity, et cetera? What are the rates of pay for direct service providers? And then also, what does that kind of pay gap or pay distribution look like between the highest paid and lowest paid staff members within agencies? And then also looking at diversity of staff across providers by race, ethnicity, sexual orientation, gender identity, disability status, and lived experience as well. So those metrics are within the equitable service delivery category. Any questions here?
Yeah,
Yep.
thanks. Commissioner Myron had a question.
Yes, please.
Yeah. So one of the things in the larger goals, what it talks about is increasing culturally specific organizational capacity. And to me, that doesn't necessarily get at what it is that we want to see, like what the actual change that we want to see. Because I first of all, I hope that this overarching approach is not just about capacity, because we need to do way more than just increase capacity. And with this amount of funding, it can be a game changer as to how we coordinate our systems and do things differently. But even in terms of sort of framing this as increasing the culturally specific organization capacity, it doesn't seem to account for the outcomes that we actually want to see, so that the people of color who are chronically homeless get housed and are able to retain that housing. And so where is the sort of accountability built into this to ensure that it's not just giving, though I love our community-based organizations, but it's not just giving money to these organizations because they're culturally specific organizations, but what are the specific outcomes that we want to see that they will be held to account for?
Thank you, Commissioner. And this is Nui answering the question, and Mark, of course, jump in. That's a really good point. I mean, this is meant to be kind of across the program more broadly, what those kind of actual outcomes of the program look like. That's not to say that we can't create our own kind of local standards and requirements for how the funding is going to flow, and then also what we're going to put in the actual contracts with providers in our RFPQ or RFP that goes out to actually solicit folks for that funding. We can certainly put our own kind of standards on who gets that, what the needs are. We are also conducting a gaps analysis that will go into more detail soon. That's really to identify kind of what are the needs, not only definitely for the target populations, but then also among providers, kind of what are the needs for their capacity? Is that a need within the system itself? So it's not to say that, we're not going to blanketly assign funding to providers across the board. We're certainly going to develop standards for that funding. But I understand what you're saying in terms of, this direct metric doesn't necessarily tie to that. As it's stated, no, but we can put a lot more underneath that in terms of the standards that we expect to see in our contracting and our funding allocations.
Thank you.
Commissioner Jayapal?
Thank you, Chair. Just a follow-up question that maybe I think relates to Commissioner Myron's question. The metrics that we're seeing are descriptions of metrics. So in the previous slide, for example, if you could go back to that actually, Teja, that might help me articulate my question. So we're describing the metrics: rate, housing retention, average length of homelessness. I'm assuming that we will both overall and, as you described, Nui, in provider contracts, then add specific targets, objectives to those metrics that we plan to meet, not necessarily over the full 10 years of the measure, but let's say year one, we would be aiming for an average to get to average length of homelessness of X or rate of housing retention of Y. Is that correct? Are we going to add some actual objectives to these metrics?
So I don't know that we'll stream an objective from every single metric. I think we're going to have to kind of take it case by case to see what's needed. I mean, some might be a very simple calculation, whereas others might need a little bit more, right? So yes, we will absolutely be doing that. We do, as part of our local implementation plan, we are to develop a set of goals and kind of change those annually. Those are really to stem, though, from that gaps analysis. So they most likely will tie to the metrics, but maybe not each one specifically and individually. So yes, we will certainly, we still need to have conversations around calculations of these metrics and kind of what that looks like. And so in that process, I believe more specificity will also be put.
Yeah, that makes sense to me. Not all of them would lend themselves to an easy, here's a number, but
right. But some do. Yeah.
Yeah. Okay. Thank you. That's helpful.
Right. Yeah.
Commissioner Stegman. Sorry, Commissioner Stegman.
Thank you, Chair. I had a question, Nui, about the rates of pay for direct service roles and pay distribution. So I'm glad to see that in there, but I mean, we know that a lot of our service providers and contractors make minimum wage. So can you talk a little bit more about how we are going to ensure that the people can make a living wage that work for these service providers?
Commissioner, this is Mark. I can try to address that. I mean, I think this is a good example of what Nui was just describing in terms of, what we know now is that we want to be tracking this information. There isn't an established sort of goal for what equitable pay would look like or what the acceptable sort of range between frontline workers and sort of management workers within organizations would be. I think, as you know, we're having those conversations with our community of providers right now. It will sort of necessitate some regional nature of this conversation, right? By virtue of these metrics being in here, we're going to be showing it. We'll be able to identify what pay rates actually are and how they differ across organizations. So I don't know that this is telling us that there is a specific kind of wage level to which we need to get. It's much more saying we need to be tracking what we're doing, and it insists on us having that conversation as a county that is using these resources, and then as a tri-county region as well. But I think at this point we don't expect to see in our local implementation plan sort of specific goals tied into that, simply because there's so much background work that needs to be done in terms of assessing those questions, the fiscal impact of those things, and what it would mean to have an appropriate goal set for this system and for this resource.
Okay, thank you, Mark. I appreciate that, but I think that it's important that we pay our frontline workers that are doing this work that we would not be able to do otherwise. And I'm concerned that many of these same people that work for these community service providers are also receiving services from the county. And so, I mean, I realize, so I would urge that we look at providing people a living wage that are delivering these services. And I know we're in the early beginnings of this, but I don't think that is something we should lose sight of.
And Commissioner, we totally agree. And I think Mark said it, and I'll say it again. And I think we've talked about this before, that it's one of those things that's much easier said than done. And it's not just the frontline workers in the homeless services, it's frontline workers all across our nonprofit partners. And also many of these nonprofits that we contract with get contracts from other places as well. So trying to figure out how to raise the wage level of all of the employees is really something that's at the top of our minds. It is going to take a little while to do, however.
Thank you, Chair.
All right, Commissioner Vega Peterson, did you have a question?
Sorry, I couldn't get off mute. No, I don't have any questions. I appreciate the questions from my colleagues, though.
Great, thank you. All right, Nui, keep on trucking.
Great, thanks. Can you advance next slide as well, please? There we go. So the last category we have for outcomes metrics is engagement and decision making. Again, we are centering equity in this metric. The goals are really to make sure that BIPOC folks are overrepresented on decision making so that they're part of advisory boards, committees, et cetera, that are making major decisions for this program. And then also folks in BIPOC communities, as well as folks with lived experience of homelessness, are engaged, over-engaged, I should say, not engaged disproportionately, are over-engaged in the processes to inform decision making. So the way that metric plays out is looking at the percent of all advisory and oversight committee members who identify as BIPOC or as having lived experience of housing stability or homelessness. So in other words, lived experience of the populations that we are prioritizing for this program. There's no questions on that one. We can move to the next slide, please. All right, now we're just going to jump through quickly.
I had a question on that one. I'm sorry.
Oh.
Typing, I have a question, but just wanting to account for, when we talk about representation of those who are being impacted and have lived experience in our systems, I think it's important to include, and maybe this can be included in our local implementation plan, but if we are talking about chronic homelessness again, which is the primary thing that we're trying to address here, ensuring that people with experience of serious mental illness or that have been through through systems of residential treatment for substance use disorder, or people who have those experiences would be really important to be included in the engagement. And is there a way to, and just because someone has lived experience of housing instability or homelessness does not necessarily mean that they have lived experience of being in an institution or taking medications or getting off of substances or whatever those are, which pose huge barriers and challenges. Is there accounting for that?
Yeah, so it doesn't show specifically in this metric, even though it's labeled as engagement and decision making. There is a full requirement in our local implementation plan that we'll go through in a moment, that Josh will share more about what community engagement process looks like. We are tasked with an inclusive community engagement process to inform the local implementation plan and then also to inform the subsequent programming that rolls out. So that does include a much more concerted effort, not just getting folks at the decision-making tables, but also to inform the content of the plan, inform the programs we ultimately design. We are in the process of right now going through that extensive community engagement process to reach as many of the folks that represent, these priority populations in these various ways. And so, I think when we get to that point, if you're not seeing the detail there, we can, discuss that, I think, once we talk about community engagement. But really, we are tasked with reaching out, making sure we get those perspectives into the plan, across the board, even within subpopulations.
Thank you. And is there any way, I understand that the metrics are developed by Metro and they had, but I wasn't even aware that this was happening. And is there a way to, I think they could use some designing potentially. Is there a place for a conversation about that or an opportunity?
So Commissioner, this is Mark. I think my understanding, we can follow up with Metro, is that this this part of their process is essentially wrapped up. There is, there is a process of trying to operationalize these metrics that we'll be engaged with them on. And as Noe said, we have the opportunity in our local implementation plan to identify additional measures that we would like to have in place. And so I think if we want to drill down a little bit into the lived experience kind of metric and ensuring that we have folks with experience in recovery programs or behavioral health programs specifically represented, that's absolutely something that we can do. And that's within the purview of our sort of local implementation plan development. And so if there isn't a chance to reshape aspects of this with Metro at this point, again, we have some control over what we do locally that we can flag this particular issue for you. And I think we're going to get other feedback like that from other groups in the community as we go through our engagement, and we'll try to reflect that in our local plan.
Thank you, Mark. That's really helpful.
All right, continue on, Noe. Thanks.
Excellent. So you can advance the slide, please. You can advance it again. We're going to go a little bit more into detail on the local implementation itself. So each county is developing, in the process of developing, a local implementation plan for this program. For Multnomah County, we're again leveraging our own Home for Everyone infrastructure, using the coordinating board to kind of be that first approval or recommendation for approval level. And that will go to our coordinating board early November, then the executive committee, and then of course the county board in December to get this plan approved for Metro by January. And it takes about a month or so in lead time for Metro to go through its own approval process. So this plan is going to be a very high level plan. We're talking 25 pages. When you look at the actual categories in a moment, you'll kind of see that's really not a lot of space to get into any level of detail, or a very minute level of detail, I should say, within any component of the plan. So we're looking very high level. And so on that note, we're creating this broad plan. However, we're still going to engage the community after the plan to get into the weeds more on what should the programming look like. What should procurement standards be? How is this all going to roll out? We went through the metrics already. And that this is just to say we're collaborating across the 3 counties, not only just to figure out where our systems might align, but in the planning for the actual program and the local implementation plan itself. So we meet weekly actually with Washington and Clackamas counties. We have developed a common draft or outline for what this local implementation plan will look like. And the purpose there really is to align the way the plans are presented and what's included in the plans across the 3 counties. Not necessarily that the content exactly needs to be the same, but the overall structure. We want as much alignment there as possible. So you can move on to the next slide, please. I mentioned a little bit about our timeline before, that we're on a short timeline. We're engaging with the community to get input on the local implementation plan, I guess almost last month now. September is almost over, and through October as well. November, that's when drafting starts too. November and December are largely plan review, plan edits, plan approvals, those various channels that I mentioned before. Move on to the next slide, please. Next slide as well. We're just going to go quickly through kind of bigger buckets of what's going to be in the plan. So this is not a detailed outline by any means, but our plan's going to include a background section, of course, as most plans do, with an executive summary, a little bit about how the plan was developed, how regional coordination played out in the actual planning and development of the plans themselves, how we're centering racial equity throughout the process. That also brings me to the gaps analysis. We are undergoing a full analysis on the population needs with using our data, and then also the feedback through community engagement. We're also performing a racial equity analysis, really to see what are there disparities specifically for BIPOC communities. What do those look like? What are the needs there? Also feedback from the community for that analysis as well. So there's kind of 2 analyses happening in tandem right now. And those are going to inform the rest of the plan, which will be our planned investments. And then, our outcomes and evaluation is, yes, restating some of those kind of universal across the 3 counties metrics that have been identified by Metro, but then also any identified local metrics as well. So we're going to dive into a little bit more detail on investments and outcomes. So you can advance to the next slide, please. So the investment plan piece of our local implementation plan is really the meat of the plan. It's going to take up the most space. It's going to be the most detailed part of the plan, and will include a number of different things. You can see them listed here. We are going to lay out what our strategies are specifically to address racial disparities, both racial disparities that we know exist now, but then also what we identify through our analyses and through our engagement. What are our current investments in culturally specific services? Where are there gaps there? And that brings that kind of capacity question. How are we going to address that? What are planned investments by services type or intervention type? So for example, permanent supportive housing, rental assistance, services, and what types? And then are we going to phase those? So it is a requirement in the plan to figure out how investments might be phased over at least the first 3 years. And I don't think that's a requirement to, have a detailed budget line by line over 3 years, but really we are planning to invest in these types of things up front. Like, for example, if there's system capacity needs up front, and then or supportive housing commitments up front, that we would state those in the plan. And to the best of our ability over the first 3 years, kind of indicate what sequencing might look like in terms of what programming comes online, what we invest in. We will be discussing in detail, to the extent possible, how we will leverage other system resources. We're talking about other capital, since this doesn't pay for capital and expenses in supportive housing, for example, are we leveraging existing units? Are we leveraging units on the market? Are we leveraging other types of services that serve these populations that aren't necessarily aligned yet with the homeless system? We are ensuring that there's an equitable geographic distribution of resources. So where are resources not as prevalent? Are there certain populations that are high in need that just don't have a wealth of resources around to serve their needs? And then how are we coordinating access to services both locally, which is extremely important, and then across the region to the extent possible? So that can include things like data sharing, can include things like triage. If somebody shows up in one county but lives in another county, how are we addressing that need? And then finally, we're going to lay out our procurement strategy in terms of what our standards are for procurement. That is going to evolve over time, but to the best of our ability, what broader standards are we setting in this plan? What is how are we ensuring that there's transparency also in decision making and the information that's communicated out around transparency?
And Nui, this is a lot of information here. We're going to have to speed it up a little bit for almost.
Yeah.
Commissioner Myron has a quick question.
Sure.
Yeah, and I guess, and maybe I'll get to it, but just in terms of leveraging other system resources, is that something that, is that the kind of thing that, like, using Medicaid to get housing services kind of thing, which is something we absolutely should and have to be doing?
That absolutely includes things like that. Yeah.
Thank you.
All right, can you keep going, but maybe just put it on fast forward a little?
Absolutely. Yeah, we can certainly do that. Next slide, please. So we talked already about outcomes and evaluation. The only point here to really mention is we're, again, stating that we're going to meet those metrics we already went over. We can list any identified local metrics. Again, we can always add more later. This is not a requirement of this plan. In that we want to include the community as much as possible in when we review data, when we review outcomes, and how we kind of change the course over time if needed. Next slide, please. So now I'm going to hand it over to Josh, who's very quickly in our last few minutes going to talk about our engagement process for the local implementation plan.
All right. Good morning, Commissioner.
Thank you, Nui. Good morning, Josh.
Good morning, Chair. I'm going to try to go quickly without sounding like an auctioneer. Can we go to the next slide? All right. Actually, this is Nui. I believe that you were going to talk about this slide since you've been leading the jurisdictional coordination.
Indeed, yes. We'll move through this quickly. So we are engaging the community both kind of at the jurisdictional level and then the broader community stakeholder level. So within the jurisdictional side, we're working with each of the different departments within the county, also across certain departments within the city, also have reached out to Gresham, Troutdale, and Fairview to engage those cities. I mentioned our regional coordination meetings already. And then we also internally have both kind of a county director leadership team as well as kind of a county representative policy team. And the policy team really is meant to help not only inform the plan, but help inform how the programming will roll out, but also how we're going to align in better ways across county departments, particularly around services for this population as this program rolls out. So I will hand it over to Josh now.
Okay, it's back over to me. Can we go to the next slide? All right, so as Nui spoke about a little bit earlier, we're in the midst of facilitating this inclusive community engagement process that's very comprehensive. And the purpose of this is to receive feedback from community members on priority services and programs for the local implementation plan. The methods that we're using to do this engagement are facilitated discussions. We're doing individual stakeholder conversations. We've generated a survey, and we're really trying to find a way to engage as many folks as possible, as many stakeholders as possible across our region. As Mark said earlier, there are vast disparities in rates of homelessness for communities of color. So throughout all of this engagement, we're also leading with race. We're leading with racial equity. And the way that we're doing that is both prioritizing communities of color and engagement, as well as asking questions to all different stakeholders around racialized disparities and around how you can implement equity into the specific domains that folks are within. So we're going to be completing this engagement by the end of October. We've been doing this now for about a month, and then it's going to be synthesized into the local implementation plan. And this plan is leaning heavily on this community engagement. So some of the facilitated discussions we've had up to this point are with the different Home for Everyone work groups, with the equity committee, with the coordinating board. We've also been engaging with our culturally specific organizations that are currently contracted with the Joint Office. We've had conversations with the Multnomah County Advisory Committees, with specifically the Behavioral Health Advisory Committee, the Multnomah County Public Health Advisory Committee, and the Aging Services Advisory Committee. We're also engaging with the different system leadership. So that's specifically in our family system, our adult system, our youth system, our DV system, and our coordinated access. And then finally, we're engaging also with community coalitions. We've been in talks with the Coalition of Communities of Color. So, finally, to Commissioner Myron's earlier question, we've also been talking to the Mental Health and Addictions Association of Oregon. We're going to be having an engagement with them later in the month, or early next month, because we're already at late this month, and the Mental Health Association of Portland. So really, we're trying to engage as many folks, as many spaces as possible. And also we're having an individual stakeholder conversations with elected leadership. As Nui sort of alluded to, sorry, my daughter is making a lot of noise in the background, my apologies. And then we're also, it always makes me feel a little bit like anxious. I don't know if there's something biological about it, but when she's crying, I'm like, dang, my like spider sense starts kicking in. And then also we've been engaging with community leadership in these individual conversations. Can we go to the next slide? Also, I would be remiss to say, to say that we also have been engaging, or we're scheduling engagements with both outreach workers and groups, and also neighborhood associations. So we're really trying to also engage with folks that are directly doing this work and that have been doing this work even outside of the specific confines of the joint office in our network. We also have been working with HREC, with the homelessness resource, with the HREC out of PSU, to generate a survey for BIPOC community members with lived experience of homelessness. This will be disseminated through the Street Roots vendor structure, and it'll also be disseminated through our culturally specific organizations to program participants. And then finally, we're going to be creating a larger survey that will be disseminated throughout our community. So folks that have participated in our conversations will be able to do follow-up through this, as well as folks who haven't been able to engage through these different means. So that survey will be available on homeforeveryone.net. And we can also share that link out after this conversation. It'll go live within about the next 24 hours. So I'm sorry if I'm going kind of quick. I do know that we had like 11 o'clock as the cutoff. So if anyone has any questions or if there's any comments about this, I don't know if right now is the best time to do that, but I'm here.
Wonderful. Now is the best time to do that. Although we do not mind when we hear little baby noise. Our hearts sings. We love that. Thank you. All right, I'm going to go on each commissioner for last questions or comments. We're going to start with Commissioner Myron.
Thank you, Chair, and thank you all for presenting today. This has been very helpful, and I know it's a work in progress, but given the compressed timing of everything, it is so important to get all this information. And one of the things that I just remain focused on is ensuring that we continue to highlight the population that is chronically homeless, that is living unsheltered on our street, that suffers hugely disproportionately from severe mental illness and substance use disorder, et cetera. I was very heartened to hear that you're engaging with Mental Health Associate Oregon and Portland in the effort. I think that's exactly right. We need to drill down and connect not just with sort of the broader groups that sort of represent broad sections of people, but the people, drill down to who is the most profoundly impacted and get that direct feedback. So that is really important. And I will just continue to kind of watch the process, participating in the coordinating board and on a Home for Everyone, and ensure that there's always a danger of just becoming too diffuse when we have this much money that we're talking about, these kinds of resources. It's more important than ever that we take that step back and ensure that we're using those resources as they were entrusted to us by the voters who adopted this. So thank you all very much.
Commissioner Jayapal.
Thank you, Chair. Yeah, just a couple of comments. Thank you all so much for this. It's really helpful, and it is a compressed time frame, and so much has been done. It's good to see that, and a lot more to do. Just a couple of comments. One is around evaluation, and Mark, you and I have talked about this, and we talked about it as well. I do think that's such a critical piece. So there's the metrics and establishing specific goals, and then there's also building in the piece around evaluating the specific strategies and seeing which ones are most effective for which population. So I'm really, really glad to see that in there. And one comment, Josh, on our outreach to culturally specific organizations. It's obviously important that we reach out to the organizations we partner with. And I'm also always aware that there are smaller organizations that don't even get in our front door, and that it's really, really important to be connecting with those smaller grassroots organizations as well, because in many cases, they might even have a more direct connection to the communities that we need to serve. So thank you. Thank you for keeping that in mind and for the work.
Commissioner Vega Peterson.
Thank you, Chair. I don't have any questions. I'm actually meeting this afternoon with Nui and Mark to, go through this. So the questions I have, I'm just holding for that meeting. But I do appreciate all the work that's gone into this. And I'm especially interested in the cross-jurisdiction work that's going to be happening as we're approaching this from the regional perspective, and how we're really going to be maximizing the both the investments that we're making and also the opportunities, on the regional wide level. And I would just say, and I just appreciate Joshua, the work that you've done. I know we've connected you with some East Portland organizations and folks already for that. And so we'll keep sending people your way as we think about them, but I really appreciate the outreach you're doing. Thank you.
Commissioner Stegman.
Thank you, Chair. Thank you so much for the information. Josh, I would like to maybe reach out offline. I know that you talked about Gresham, Fairview, and Troutdale. And I think there was mention of neighborhood associations. So obviously these are cities within my jurisdiction, and I want to make sure, that they're at the table, and it sounds like they are. But I would also kind of like to be kept apprised as we move forward with that work. And I really appreciate all this work. I know it's kind of hard to get, a really specific plan when you're in the planning phases, but I do like the ideas of how you've all worked very hard on looking at the metrics and the outcomes and evaluating where we're going to go from here. So thank you so much for the information.
Thank you. And I just want to say that I really believe that the success of the Here Together campaign cannot be overstated. I think it was a massive achievement, and it represents what will become one of the biggest ongoing investments in homeless services in the entire nation. And I think all of the work, all of the thousands of hours discussing policy with elected officials, service providers, business leaders, advocates, members who have actually been living inside has gotten us to this point. And we are in the right team to begin. I also want to take some moment staff who the past 7 months not only continue regular work, being thousands of people per year, but they performed near miracles to protect our homeless neighbors from crisis after crisis. To Mother Nature and everyone else, we need more crises. We're kind of done with those. We really owe joint staff a considerable joint office staff a considerable debt of gratitude and our admiration. It truly is thrilling, and to go help others in the face of crisis, and staff member of the joint office embodies character. So I'm very, very proud of you all, and I'm proud to get to do this work with you. And that is the end. Sorry, Mark, I didn't even leave you with last words.
I'll just
That's
say
the end
thank you.
of our here. We will be back here in virtual land Thursday morning at 9:30 for our board. See everyone then. Thank you for your time. Thanks, team.